Welcome everybody to the launch of the VCCC Alliance Strategic Program Plan 2021 to 2024. My name is Professor Grant MacArthur, the Executive Director of the VCCC. I'd like to begin by acknowledging that I am speaking to you today on the traditional country of the Wurundjeri people of the Kulin Nation and pay my respects to elders past and present. I recognise and respect their cultural heritage, beliefs, relationship with the land, which continue to be so important to the Wurundjeri people living today. I'd also like to pay my respects to the traditional owners of the lands at which each of you are present today during this webinar. So we're delighted today to be launching the new VCCC Alliance Strategic Program Plan 2021 to 2024. And I'd just like to begin by covering why we think this plan is important. Cancer remains such a major issue in Australia. It's a leading cause of death and has the greatest total disease burden of any group of diseases that our community faces. This year, there's anticipated to be nationally 150,000 new cases of cancer diagnosed and almost 50,000 deaths, sadly, from cancer. Cancer diagnosis will be made before the age of 85 of 1 in 2 Australians. So really, this is a set of diseases that touches us all. It's a major burden in our society, and clearly cancer is really a set of very complex diseases. And so that's why we need an alliance and a collaborative approach to improve outcomes for patients. We're very fortunate that Victoria has exceptionally good outcomes for cancer when we benchmark ourselves internationally. However, there are some cancers that continue to have poor outcomes. And very importantly, we have to recognise that there are some groups within our community that are not on par with others. And this is a major driving force behind the plan that we're going to talk about today. So in November 2019, the VCCC Alliance submitted a business case to the Victorian Government setting out how our 10-member alliance of cancer institutions would work together with many colleagues across the state to see what we can do to reduce the burden of cancer for all Victorians. So in the 2020 Victorian State Budget, the VCCC Alliance was allocated $27 million over 3.5 years to help us build on previous efforts and progress made in recent years so that we really can, in an equitable way, bring cutting-edge cancer research, education and care to all Victorians. So I'm delighted today that we're joined by the Victorian Minister for Health, the Honourable Martin Foley MP, who will talk to us about our shared goals for improving cancer care for all Victorians and this plan that we've developed strategically and collaboratively to address some of the key needs and opportunities. Minister Foley will speak a little later, but first I'd like to touch on what is a remarkable achievement in its own right, and that is the gestation of this strategic program plan and how we go about doing this at the VCCC Alliance. It's actually a result of the collective effort of over 250 people from 35 organisations around our state. We came together with a shared agenda, people bringing their leadership, expertise, knowledge and determination to really make a difference for cancer patients. So through a lot of debates and consultation and analyses over a period of 18 months, we were able to develop this plan. And I'm particularly pleased at the input we received from patients and consumers to our plan, which remains at the heart of the way we like to do business of tackling the problems of cancer at the VCCC. So I think that the creation of this strategic program plan is a testament to the progress we've made and underscores the reason why we need an alliance, a collaborative alliance, to make fundamental changes to outcomes for patients with cancer. Cancer is a complex set of disease. There are complex challenges, and we do not think that can be tackled by any individual organisation alone, but needs a collaborative approach. One of the most exciting developments for us has been building conditions to support meaningful consumer involvement, not just in the planning phase, but in an enduring, integrated way to everything that we do. So I'm now really delighted to welcome and introduce to you Ms. Sophie Athan, Chair of the VCCC Alliance Cancer Consumer Advisory Committee and member of the strategy working group that guided the development of this plan to start this launch where the work will end, and that is to benefit the people of Victoria affected by cancer. Thank you, Sophie.
Thank you, Grant. I'd like to start by acknowledging country. In the spirit of reconciliation, on behalf of the VCCC Alliance, I acknowledge the traditional custodians of country throughout Victoria and Australia and their connections to land, sea and community. And we pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. This is an exciting milestone because this plan is different. It was specifically and purposefully developed in partnership with consumers. This means the starting point was different. We started by asking why this work is important for patients, consumers, and community. Putting that question first makes a real difference to the priorities of work and the nature of the program being developed. It means the direction stays focused on patient benefit. In developing the strategic program plan, 19 consumers have worked as members of working groups and steering committees with clinicians, researchers, allied health professionals, and other experts in a mutually supportive and respectful way, keeping the concept of patient-centeredness at the heart of the discussion and decision-making. This ensures that the lived experience of cancer has been integrated into the plan from its inception and will continue to its final delivery. I believe that this will greatly enhance its relevance and capacity to bring about meaningful, lasting improvement and extend benefits to many more people affected by cancer. The process of developing this plan has been highly successful. Consumers have played a pivotal role, and we feel an affinity for and even ownership of this plan and its potential, and now look forward to supporting its implementation. From the outset, the Victorian Government has been very supportive of the VCCC Alliance and the importance of the role of consumers in achieving its ambitious agenda. And we thank them for the 27 million invested in this plan. And I'm very pleased that the Health Minister is here today to mark this milestone with us. I think we can all see that the strength of the collective resources, expertise and capability of the Alliance members, including the consumers, should ultimately improve the quality of cancer care and patient outcomes. The VCCC Alliance Strategic Program Plan 2021-24 is a roadmap to significant quality and safety improvements in cancer for all Victorians. But you don't have to take just my word for it. Here's a short video featuring some of the consumers who helped develop this plan, explaining its significance in their own words.
The first question is, why are you working with the VCCC Alliance?
When you get a cancer diagnosis, your whole world turns upside down and everything that is your current reality kind of fades away.
I know people that lived 100 kilometres away and didn't survive, and it was purely because of the distance.
The VCCC has consumer involvement at all levels. That makes a difference to health outcomes. I really believe that. I'm passionate about it.
Working with the VCCC has actually allowed me to use those lived experiences to provide insights into what's important to people going through the journey.
I want to see changes for patient care, and I believe that being involved in these programs will enable that?
I know firsthand the value of having viable treatment options, and the work that we're doing stands to increase the opportunities to provide more treatment options for people facing a cancer diagnosis.
This is a very exciting time. It's building on what has already been achieved. This whole idea of digital learning, of research, of clinical trials. I mean, it's huge.
My working group is focused on data linkage, which will drive the next generation of discoveries that address critical cancer challenges through collaboration.
It's making sure that we can bring the most innovative trials to patients and consumers all the way around Victoria and then hopefully around Australia.
It's really about taking a system that's actually working really well and that using that to really fast track improvements in the delivery of cancer care.
I believe that my survival thus far has been directly related to accessing developments in technology. That's really what's driving me to participate, to make sure that other patients have access to those new developments.
Once this is up and running, anywhere in Victoria, you will have access to up-to-date cancer care in a timely manner, best suited to you as a patient.
I think we all are working towards that goal of making the experience better for others.
I'm really proud of being involved with the VCCC Alliance.
I feel as a consumer that I am making a real contribution.
Bringing that together with some of the greatest minds is going to create a far, far better outcome for everybody.
I really like their philosophy. Joining together, we can achieve much more than we can as one individual organisation.
I want other people to get the same chance as I did and live a really wonderful life and a longer life.
Well, thank you very much, Sophie, and to all the consumers for those inspiring words and for all the input and efforts that you put into the work of the VCCC. It's now my pleasure to introduce the Honourable Martin Foley, MP, Minister for Health, Minister for Ambulance Services and Minister for Equality. The Victorian Government has backed the VCCC Alliance from the outset. And I really want to thank the Victorian Government for their belief in the talent that we have in this state, which is truly exceptional, and their courage in backing a new system-changing approach to what we're doing in cancer. The investment from the Victorian Government will set the agenda for the VCCC Alliance to enable us to focus particularly on disparities in cancer outcome, a major issue for the cancer sector and the community as a whole. Thank you, Minister, for joining us, and we look forward to hearing from you. Thank you.
Thank you, Grant, and thank you, Sophie. And can I just acknowledge Sophie and the whole consumer movement has been so central to the reimagining of how care, however defined, but particularly cancer care, is to the success of the goals of the Victorian Government and the VCCC Alliance. Can I acknowledge you, Grant? Can I also acknowledge Professor Kylie Mason, Professor Andrew Roberts, and Professor Martine Argeron. And could I give a special shout out to the newly appointed Deputy Chair, Professor Sanchi Andra, and what an outstanding candidate you are. And I look forward to the great contribution that you'll have and will continue to make to the VCCC in this new role. Look, it's really, really important to the Victorian Government and to me to be a part of formally being part of the VCCC's Alliance Strategic Program Plan 21 to 24. And before I say a few words on that, I too would just briefly acknowledge the First Peoples of all the lands on which we meet and pay my respects to elders past, present and emerging of all of those communities, and acknowledge the injustices and the disparities that have resulted in poorer health outcomes for those communities, and how important the treaty and truth-telling processes that we have in place as part of our engagement with Victorian First Peoples is to that process of genuine reconciliation and the role that the VCCC and our healthcare system can play in that process. We all know that the work of the VCCC is life-changing and life-saving, and I'd like to acknowledge the millions of Victorians whose lives are touched by cancer. As Grant has indicated, cancer is still the leading cause of death in Victoria, and at least 1/3 of those cancers are preventable and many are treatable if diagnosed early. That's why this government, through the Victorian Cancer Agency, is committed to investing in cancer research to achieve that greater equitable cancer outcomes for all Victorians. Since 2006, the government, through the Victorian Cancer Agency, has invested some $250 million into cancer research projects, workforce and infrastructure, and the VCCC is at the heart and soul of that. As Grant indicated, the 2021 budget, with its investment of more than $27 million over the next 4 years, allocated to the VCCC Alliance for Research to improve cancer outcomes in Victoria, is a really important part of what we do. This will go some way to deliver improved patient outcomes, support the clinical workforce, and contribute to a thriving Victorian biomedical industry. And we are more than confident we'll continue the path towards a more equitable cancer outcome right across Victoria. We know that this funding will support and accelerate cancer research, embed translational research into routine clinical care and activity, and it will also invest in initiatives to improve cancer outcomes for all Victorians wherever they are in our community. And importantly, it will continue to deliver cancer education programs through the Victorian Centre for Cancer Education. It's a truly ambitious program of work that sets to achieve this in a plan which builds on the previous government's investments towards the VCCC Strategic Alliance Research Plan, which ticked over a few years ago. It also seeks to tackle complex challenges, particularly the disparities in cancer outcomes that bedevil regional Victorians and those Victorians from vulnerable communities, such as our Aboriginal, Torres Strait Islander and First People communities. As Sophie touched on, consumer engagement has to be and is continuing to be a significant feature of the consultation process for how we got to this plan and how we will roll the plan out. The Alliance undertook an 18-month consultation process to develop this important plan. As Grant said, more than 250 people, more than 35 organisations, all major disciplines, all contributing to the development of the important plan. Expert steering groups, 10 strategic international programs, interconnected programs, and international links all helped get us to the point we are. And importantly, consumers with lived experience were members of the steering group, which has contributed to the design of the programs. So the Victorian Government's funding also supports our response to some of the unintended consequences of the COVID-19 pandemic that the VCCC and cancer treatment has been enduring over these past 18 months. We all know that the pandemic has had a significant impact on cancer screening. Due to the effect of this pandemic, far too many Victorians have delayed regular health checks, including cancer screening programs. And I take this opportunity to remind people that cancer screening programs are still operating. There's been some misinformation that hasn't been particularly helpful, but I know our hard-working screening staff are being out there implementing COVID-safe measures to keep those important programs going, and in many cases, to now actively expand them. Because cancer does not stop, even during a global pandemic. And this is why the Victorian Government continues to work closely with all of our health services, with all of our VCCC partners and all of our community organisations to support the catch-up and promote screening. We've also invested in a package of work to increase cancer screening participation for particularly vulnerable communities who have been disproportionately affected by the pandemic. This includes equipping the primary care sector to maximise patient engagement through targeted screening outreach to those vulnerable population groups. We are also working with peak bodies to encourage Victorians to participate more readily in cancer screening and to seek early medical care for cancer-related symptoms. Victoria is the leader in health and medical research, with Victorian cancer researchers comprising a really large proportion of this sector. You should take great sense of pride and achievement in where you've got to, where we have all got to. This plan and the work that's gone behind it is all about taking us to a new level. I commend everyone for striving for the best outcomes for Victorians impacted by cancer and your work throughout this pandemic to ensure that cancer remains at the forefront of our public health discussions. I wish you the best and I look forward to the rollout of this plan in the interests of all Victorians. Thank you very much for your time.
Thank you very much, Minister Foley, for those words. I'd really like to thank the Victorian Government for their support for the vision of biomedical research in Victoria, where we're passionate about taking the very best of the world-leading science in Victoria and turning that into better outcomes for patients, and the Victorian Government are a key part of the mechanism and support for us to do that. And also, Minister Foley, we have been through a tough time in our state through the pandemic, and thank you and your government for the support for the cancer sector throughout this time. And we're confident that we can minimise the impact of the pandemic. And like in many areas of healthcare and very much cancer, that Victoria can lead the way in the response in mitigations of the difficulties we all face in the pandemic. So thank you very much. So I'd now like to also mention, Minister Foley mentioned the appointment of Professor Sancha Aranda AM as the new Deputy Chair of the VCCC Alliance. So thank you to the Victorian Government and Minister Foley for appointing Professor Aranda. She's able to join us today. And I think many of us know Sancha well, such a major contributor to cancer control, not just here in Victoria, but indeed nationally and internationally. And she really has an exemplary track record in fostering and applying collaborative leadership at an international level. And, particularly with our priorities now in this strategic program plan, a deep interest in improving equity in cancer care throughout her career. So it's wonderful to have you on board, Sancha. And perhaps before we delve into the details of the strategic program plan today, I'd be interested in asking you a question, Sancha, and that is, I'd be interested in your view on why you think Victoria needs a strategic program plan led by the VCCC Alliance.
Thanks, Grant, and thank you, Minister. I'm very honoured to be offered this opportunity to contribute to the work of the Alliance. And I well remember the early discussions at the point where the building was just conceived in the minds of, particularly at that point, Daniel Andrews, who was, of course, the Health Minister. And the question being asked about how $1 billion investment in a building would help to improve outcomes for every Victorian. And I think that challenge has continued to be the one we have. And the Minister's mentioned that particularly the Parkville precinct is a biomedical powerhouse and contributes to Australia and Victoria having the best cancer outcomes in the world. But for me, that's not for everyone. And Chris Wild, the former director of IARC, once said that every discovery should be measured by the extent to which it either widens or narrows the equity gap. And so for me, that's the overriding reason why we need a strategic program plan led by the VCCC, because all the elements are there. And in addition to equity, we have cancer treatment and care becoming increasingly complex. We have, as I'm sure Martin will raise later, data issues where we have very poor ability to really measure the performance of our system. And we have system issues where the tendency is always for highly specialist services to develop models of care centred on themselves rather than on equity and delivery of services right across the state. And so we cannot afford to work in isolation. And what I love about this strategic program plan is it's centred on equity, it's centred on collaboration, and it's centred on involvement of service users and using data to drive improvement. So 4 of my passions, and I think that is exactly why we need a strategic program plan led by this group.
Thank you very much, Sancha. That's I hope all 500 people that are joining us today and those that watch this webinar after the date will take notes for those inspiring words, because I think that sums up really what we can achieve on behalf of cancer patients. So we'd now like to get into the plan in more detail. So the development of the plan, as you've heard, had input from many people across many organisations, but that putting together of the plan was guided by a strategy working group of 4 people, and their task was to ensure the plan met these strategic objectives and some of the key elements that we've heard about from the Minister and from Professor Sancha Aranda. So I'd like to introduce to you today Professor Andrew Roberts, AM, who is Chair of the VCCC Alliance Cancer Research Advisory Committee and also a member of the VCCC board. Andrew is cancer theme co-leader at the Walter and Eliza Hall Institute, WEHI. He's a clinical haematologist at the Royal Melbourne Hospital and Peter MacCallum Cancer Centre, and Metcalf Chair of Leukaemia Research at the University of Melbourne. Welcome, Andrew. Next, I'd like to welcome Associate Professor Kylie Mason. Kylie is Chair of the VCCC Alliance Cancer Education and Training Advisory Committee. She's a consultant haematologist and clinical researcher at the Peter MacCallum Cancer Centre, the Royal Melbourne Hospital. Is a clinical associate professor at the Sir Peter MacCallum Department of Oncology at the University of Melbourne. And because Kylie has broad vision, she's also a senior research fellow at the University of Sydney. Thank you for joining us today, Kylie. Also joining us is Professor Martin Eisenman. Professor Eisenman is the VCCC Alliance Academic Chair for Cancer Health Services Research and Chair of Cancer Health Services Research in the Centre for Cancer Research and Centre for Health Policy at the University of Melbourne, and also at Western Health, one of the VCCC Alliance members. And also joining us in this next session will be Sophie Athan, who you've already heard from, who is Chair of the VCCC Alliance Cancer Consumer Advisory Committee. So over the next 20 minutes, what you're going to hear is our panel of experts and leaders take you on a visual guided tour of the 4 pillars of the strategic program plan. That is discover, accelerate, equity, and leadership. And these 4 pillars of our work are, of course, absolutely intertwined and connected at multiple levels. And we think that the work you're going to hear about in the plan will really instill our vision for saving lives through the integration of cancer research, education, and patient care. Andrew will start with discovery and also then acceleration, followed by Sophie, who will talk about our equity pillar, and Kylie will discuss leadership. And then we're going to come back and be joined by Martin for a panel discussion. So over to you, Andrew, to kick us off.
Thank you very much, Grant. Great to be here. Exciting times. The objective of the discovery pillar is to drive the next generation of discoveries that address critical cancer challenges, and to do this through collaboration. In the long term, this is how we will make the biggest difference for the largest number of people with cancer. We're going to do this through 3 programs. First, we will achieve vital data linkage. That will link biological, clinical, genomic, and patient experience data so that new knowledge can lead to discoveries and their application, including commercialisation. This will ultimately influence policy, treatment guidelines, and clinical practice, improving outcomes along the way. This program will be guided by a steering committee co-chaired by Professor John Emery from the University of Melbourne and VCCC Alliance, Dr. Anna Collins from St Vincent's Hospital and the University of Melbourne, and Dr. Belinda Lee from WEHI. Our second program in the discovery pillar is personalised cancer care. We firmly believe that the future of cancer care lies here. This program aims to drive the translation of cancer biology knowledge into 20th century personalised cancer care, placing priority on new technologies and shifting the dial on low survival cancer. This work will be guided by Professor Sean Grimond from the University of Melbourne Centre for Cancer Research and Associate Professor Paul Neeson from Peter MacCallum Cancer Centre. In the third program, we will rapidly propel the development of truly novel therapies and critical early phase clinical trials in a program that provides new treatment options for more patients. This trials program is under the stewardship of Associate Professor Cara Britt and Associate Professor J.S. Desai, both from the Peter MacCallum Cancer Centre. So let's take a look now at what this will mean.
The fight against cancer starts in the lab, and our researchers need to be armed with the tools and technology they need to optimise the impact of their work. The discovery pillar of the VCCC Alliance Strategic Program Plan will empower collaboration across the VCCC Alliance to drive the next generation of discoveries that address critical cancer challenges. We'll focus on 3 core initiatives to enable discoveries: linking data, personalised cancer care, and the development of novel therapies. We know disjointed healthcare systems mean reduced patient care and outcomes. By connecting clinical, biological, genomic, and patient experience data, we'll gain a better view of the patient experience across the entire continuum of care. We'll help link together large-scale primary care and acute services data, and we'll give researchers access to ethical, streamlined insights. We'll build a central hub to support project design and build capacity, and we'll explore new ways to connect even more different data types. We're aiming to drive a major upsurge in data-driven cancer research projects to gain new knowledge about cancer and ultimately access better data to improve patient outcomes. Our researchers are making breakthrough discoveries in immunotherapy, but we need to deliver these innovations to the patients who need them most. We'll make it easier for clinicians to translate groundbreaking cancer biology into personalised cancer care and bring together cross-functional teams critical to effective research translation. We'll build a translational research hub to support and coordinate new research and champion an agile approach to allow more patients to access current and emerging molecular tests. We're striving to boost the number of patients accessing molecular and immunological tests to personalise their treatment and increase their chances of a better outcome. Early phase clinical trials are the first crucial steps in assessing the potential for a novel therapy to improve care. Yet roadblocks and red tape can get in the way. We'll create a standalone VCCC Alliance drug formulary to accelerate access to drugs for research and clinical trials, as well as a clinical trialist development hub to support new trial designs. We'll optimise clinical trial databases and processes for use across Victoria. We'll upskill and equip clinicians and scientists and work with industry to get research from the lab into early phase trials. It's our goal to increase the number of early phase clinical trials so more patients can access the right therapies in the right place at the right time. These discovery initiatives are fundamental to changing the way we tackle cancer in Victoria and will enable researchers and clinicians to deliver the next generation of breakthroughs to benefit patients with cancer into the future.
As crucial and exciting as they are, discoveries themselves don't get themselves from the laboratory, research project or trial into clinical practice. It takes a whole raft of processes and procedures. So this next pillar, Accelerate, is about finding ways to get discoveries into routine practice. It's also about doing things smarter and more cohesively so people with cancer benefit sooner. In this pillar, we will have another 3 programs. Clinical trial innovations will drive a high-performance clinical trial sector and improve participation rates in clinical trials across the development spectrum through new, creative and efficient processes. Professor Peter Gibbs from WEHI, Western Health and the VCCC Alliance co-chairs this program with Marion Leschke, manager of the Parkville Cancer Clinical Trials Unit. In a major new investment, the new value-based cancer care program co-chaired by Associate Professor Carla Goff of Peter MacCallum Cancer Centre and Professor Martin Eisenman will scientifically test the best way for us to tackle some of the most pressing immediate problems in cancer. It will help us get smarter and more efficient about cancer care and deliver the things that people affected by cancer really want and need. Finally, we need a new wave of leadership to build and to take us forward. One of the fundamentals of the VCCC Alliance is its model of distributed leadership. This third program will empower leaders to work across organisational boundaries, identifying key opportunities and finding ways to get the latest evidence into practice. This truly is at the very heart of how the VCCC Alliance works. This next video gives us a bit more insight into how these programs will speed things up.
Discoveries play a crucial role in the fight against cancer. But how do we get them into practice so they can benefit more patients sooner? The acceleration pillar of the VCCC Alliance Strategic Program Plan sets a course for system-wide change to rapidly implement evidence and value-based cancer care in routine practice. We know patients do better when on a clinical trial, so we're committed to driving a more innovative, high-performance clinical trial approach. We'll use new trial designs to increase the number of patients on clinical trials and make it easier for patients right across Victoria to access trials. We'll upskill the clinical trials workforce to deliver more trials more often, and we'll consult directly with consumers to identify barriers to patient participation and act to reduce or remove them. In the years ahead, our aim is to boost the number of patients on treatment intervention trials and significantly increase the number of cancer patients across VCCC Alliance member sites enrolled on a clinical trial. Unfortunately, not everyone's experience of healthcare is equal, and that gap widens when funding structures are based on quantity, not quality. The model of value-based care sets out to deliver health services when and where they are needed most, with a specific focus on the outcomes that matter to patients. We'll design and undertake proof of concept tests for priority areas, such as timely and efficient diagnosis and avoidable readmissions. The goal is to forge a pathway to a system where patients improve their well-being, spend less for better outcomes, and can access coordinated, integrated care when and where they need it. Our strong network of leaders from across the VCCC Alliance aims to harness collective effort to achieve maximum gain. We'll further strengthen these networks of knowledge and expertise to identify the thorny research and clinical questions that require true innovation, collaboration, and system-level change. Together, we'll drive more rapid adoption of new research evidence into routine practice in tumour streams, as well as areas such as cancer nursing and primary care, to ultimately transform patient outcomes. We'll also leverage our collective potential as a network of leaders in cancer research and care to target improvement in survival rates in key poor outcome tumour streams. The acceleration pillar of the VCCC Alliance Strategic Program Plan represents potential for a tangible shift in cancer care in Victoria as we strive to overcome cancer together.
Thanks, Andrew. As Grant and Minister Foley have acknowledged, cancer care is not experienced equally by all Victorians, and there are a range of factors that play into this. This pillar of the strategic program plan is intended to level the playing field so that everyone in Victoria can experience the world-class cancer care this state is known for. 2 programs will help us step towards this important but challenging goal. The first will look to regional Victoria, where we know cancer outcomes still lag behind metropolitan levels, using a range of measures to pursue equity in access to clinical trials and other cancer care for all Victorians affected by cancer. This will be guided by Dr. Craig Underhill, the VCCC Alliance, and Albury-Wodonga Health, and Associate Professor Kate Burberry from the Peter MacCallum Cancer Centre. The second will examine how we can do better for vulnerable groups in our community. With cancer outcomes for people from culturally and linguistically diverse backgrounds and Aboriginal and Torres Strait Islander people coming in at significantly lower levels than the rest of the community, we have a lot to do to change this. Professor Jennifer Phillip, VCCC Alliance, University of Melbourne and St Vincent's Hospital will guide this with an expert steering committee. Here's a bit more information about how we will do this important work.
Victoria has some of the best cancer outcomes in the world, though this privilege is not experienced equally. Health equity means giving every patient the care they need when they need it. It's an assurance that healthcare won't vary in quality because of where someone lives, their gender, age, ethnicity, or socio-economic status. It means no one gets left behind. The equity pillar signifies our true north for all Victorians affected by cancer. Regional innovations and health equity for vulnerable groups are key initiatives in this crucial and urgent part of the plan. Clinical trials medicine is good medicine. This program will ensure more people in regional and rural Victoria can consider a clinical trial close to home due to ease of access and local support. We'll provide more equitable access to specialist knowledge through teletrials. We'll upskill the cancer clinical trial workforce statewide. The Regional Innovations Program will make it easier for regional health services to access VCCC Alliance resources, data and education, and will strengthen city-country networks to give greater access to interventions such as registry trials, biomarker studies, investigator-initiated and commercially sponsored trials. A new VCCC Alliance Equity Advisory Group will guide ways to address inequities. We'll appoint an Aboriginal and Torres Strait Islander research and education lead to tune in to what is needed to bridge the gap. The needs of culturally and linguistically diverse communities will be considered in research, clinical and educational programming. The equity pillar of the VCCC Alliance Strategic Program Plan acknowledges that systems will necessarily look different for different population groups. So we'll cast our vision beyond the cityscape to understand and respond to the cancer challenges across the community, especially for those who need it most.
Thanks, Sophie. I'm Associate Professor Kylie Mason, Chair of the VCCC Alliance Centre Cancer Education and Training Committee. All of this important work can only be undertaken if we have a workforce with the skills, the insight and the knowledge to do it, and leadership that will drive innovation, foster the talent and build capacity to keep us at the cutting edge of cancer care. The leadership pillar of this comprehensive strategic program plan provides the inclusive educational underpinning that will set us up to deliver these programs and much more in the years to come. 2 programs in the leadership pillar of the SPP will help to secure this. Our Leading for Impact program will enhance and bring greater diversity in all its forms to leadership in cancer to create a more connected, relevant and effective workforce. Professor Mai Krishnasamy of Peter MacCallum Cancer Centre and the University of Melbourne, together with Dr. Keely Bumstead O'Brien of WEHI, will co-chair this work. Secondly, a new digital oncology learning hub will be central to upskilling the cancer workforce statewide. The oncology sector is diverse and complex. The Victorian cancer workforce needs access to relevant, contemporary education and training so that the new knowledge can be quickly translated into better outcomes for patients. Work to deliver this new education hub will be guided by Dr. David Koch, VCCC Alliance and the Peter MacCallum Cancer Centre, and Jessica Bolson from Western Health. Here's the final animation in our series, showcasing the transformative role of leadership through education.
An outstanding cancer workforce is essential to keep Victoria at the cutting edge of cancer care. Fundamentally, this requires effective and cohesive leadership. It requires leaders with specific skills, capable of harnessing the strengths of a collective impact model. It also needs leadership that is diverse, representative, and attuned to consumer needs to ensure the benefits reach everyone. In addition, new research discoveries, knowledge, and treatments are only valuable if they can be used and applied in practice. This is where exceptional cancer workforce education comes in. Under the leadership pillar of the VCCC Strategic Program Plan, we will foster real and relevant leadership. To do this, we will invest in teaching skills to help clinicians, researchers, educators, and consumers thrive and grow as collaborative leaders. We will connect researchers, clinicians, and consumers so the patient perspective can be embedded into research questions and help drive discoveries that are meaningful and beneficial. We will encourage and support more nurses to engage in research, exploring opportunities to improve patient care. And a new pilot model for a Cancer Leadership Academy will foster best practice and establish foundations for strong future leadership. Under this leadership pillar, the VCCC Alliance will also provide accessible, cutting-edge education to help translate evidence into improved care and outcomes for people affected by cancer. A new digital oncology learning hub will offer needs-based online cancer education based on best practice and the latest proven advances. Content from the award-winning Master of Cancer Sciences program will be further enhanced, offering micro-credentials for specific skill development in niche areas. And new e-learning modules will boost the progress of the Alliance's research and education leads to accelerate progress in high-priority areas. With the injection of consumer perspectives, the leadership pillar will improve patient outcomes thanks to a cancer workforce supported by strong leadership and armed with the latest knowledge to deliver best practice care.
Well, thank you, Andrew, Sophie and Kylie. I hope that everyone feels as inspired as I do about this strategic program plan and what it will achieve for Victorians affected by cancer, both now and importantly in the future. So now we're going to move into our panel discussion and like to reintroduce Professor Martin Eiserman, Chair of Cancer Health Services Research at the University of Melbourne and VCCC, to join a panel together with Andrew, Sophie and Kylie. So now's your chance to put some questions to our group of leaders. We've got almost 500 people tuned into this webinar and we're keen to hear your thoughts and delve a bit deeper into the strategic program plan over the next 15 minutes or so. I might kick off with the first question to Martin Eisenman about value-based healthcare. So value-based healthcare, has the potential to, be a real transformation in the way that we deliver care, very patient-focused. But could you give us an example maybe of where value-based healthcare has made a difference in some healthcare setting, globally, or any specific projects that the team might kick off with from a Victorian and cancer context?
Well, thank you, Grant, and thank you very much. It's an honor to be on this panel and to be part of the VCCC steering group on value-based care. I think we need to define value-based care more in a global context and then identify where it can add value to the specific to Victoria. Because value-based healthcare as a development has recommenced in the US and Europe, and we can take some of the ingredients and try to improve value in Victoria and Australia within the specific context of the health system in Australia. And if I go back to what Sancha Aranda just told us in her introduction about the complexity of the cancer treatments and the use of the data sets that we currently have to identify the complexity of treatments, it's going to be very challenging to make sure that every Victorian receives the optimal pathway to care with that complexity. I think that's where the value-based care program could add value. So can we use larger clinical population level data sets to identify if there's disparities in access to care, if there's disparities in outcomes, and how we can improve the delivery of care to patients across Victoria.
Great, thanks, Martin. Now, Nick online asks, does the leadership pillar include upskilling and providing educational opportunities for consumers? Great question, and I might get maybe both Kylie and Sophie to make some comments on that.
Thanks, Grant, and thanks, Nick, for the question. I'd like to say that the leadership pillar does provide significant opportunities for consumers, both directly and indirectly. Directly, it's about empowering consumers through both skills and knowledge that we will leverage through the networks and the Alliance, and through educational and leadership opportunities, so that they can be more involved not only with their own cancer journey, but also to become partners within the VCCC and real partners in the Alliance that we've formed with the member organisations. Indirectly, consumers will benefit significantly through the upskilling and leadership of the professionals and the networks that we're providing through the VCCC Alliance. And Sophie, I'm sure you have something to add as well around the consumers.
Thanks, Kylie. Absolutely. I think you covered the major elements around the leadership pillar. But over and above that, there's a lot of work within the VCCC in terms of how the actual consumer strategy is developed and how it actually provides capacity, training, and different opportunities for consumers to be engaged at a leadership level, including and looking at taking the lead with some pieces of research around consumer-led research, along with co-designing and along with having partnerships that are meaningful and rewarding, in the sense that the outcomes are really focused on delivering better outcomes for the patients. In many, many ways, it's a complex process in terms of engaging consumers, and it's not just within that pillar, it's actually across all of the strategic programs, and there are lots of different elements that go what I call a matrix. So it goes horizontally and vertically, depending on which particular aspect and which piece of work do you require. So it's actually consumers with consumer skills at the right level for the right program and the right capacity. And what we try to focus on is generating a range of different consumers that come up the scale so they have increased capacity and can be contributing more in a more significant way. I think that covers it. Grant?
Great. Thanks very much, Sophie and Kylie. Professor John Seymour has asked a question. I'm interested in the proposed VCCC cancer drug formulary and how it will increase cancer drug access to patients treated at VCCC clinical sites. John, thanks very much for this question. So we're pretty excited about this and work that Associate Professor Ben Tran has led, that in conjunction with the NCI in the United States, we're modelling this drug formulary on their very successful NCI drug formulary, where the VCCC, like the NCI, will enter into contractual arrangements with multiple biotechnology and pharmaceutical companies to have pre-set agreements for access for clinical trials to a whole suite of emerging and some established therapeutics for clinical trials. So where I think this can really add value is the challenges that we all find in clinical trials research when one wants to perform clinical trials of combination treatments, bringing new treatments together from different companies, different pharmaceutical companies, biotechnology companies, and this can provide a great mechanism to enable that. So I really thank Ben for his for all of his efforts there, and we hope to be able to kick that off in the not too distant future. Now, there's a really good equity question that's come up, and I'm going to throw this to everybody because we've spoken a lot today about the importance of equity. And the question is the gap between rich and poor. How much do we think that contributes to these differences in cancer outcomes that occurs in regions, in patients of different social demographics? You know, is that a driver? I know it's a big question, but it's an important one, right? Because narrowing equity, we have to understand the underlying, causes of that. So, who'd like to make some comments about that economic inequity and how that might contribute to cancer outcomes? I can see Martin, I know, has thought about some of these issues. Martin, any comments?
Well, yeah, thanks, Grant. I think this is a very important question and a main driver for the work that we're trying to do within at least within the value-based healthcare program, to look at specifically at disadvantaged populations and how that could drive in outcomes. We know, and that's not just here, that's global experience. We know that socioeconomic status does impact overall survival and life expectancy. And that can go up to 7 years of a difference based on your socioeconomic status. So it's a very, very significant issue to cover. Specifically for Victoria, we sometimes think it has to do with regional versus metropolitan differences, but that's very hard at the relation, because there could be people with higher socioeconomic status in regional centers that have very good outcomes, but it could be very disadvantaged patients living in metropolitan Melbourne. So it's not so much of a regional metropolitan difference, it's something that has to do with the socioeconomic status, with this being disadvantaged. And we can map that, and I think that's one of the reasons for having a large data program in the VCCC, so we can obtain population level data with socioeconomic status data, with remoteness data for where people live, and match that to survival outcomes and access to care, because that's a really big driver for the program in at least program 1 and program 5.
Great, thanks very much, Martin. Yes, it is such a huge, the socioeconomic status is such a huge impact on outcome. Okay, so a question now, perhaps Andrew might get you to take this one. How do you envisage technology partners can align with you to implement this strategy and accelerate your needs to bring solutions to the patient for better outcomes? So technology partners, how can we work with them?
I think so thanks, Grant, and thanks for the question. There's no doubt the VCCC is open for business with technology partners, and that's the VCCC Alliance itself, but also it's the individual members within the Alliance. and also on behalf of other stakeholders in Victoria. I'm confident that if you reach out to us, we'll be able to put you in touch with the right people to talk about the best way to assess and, where appropriate, implement new technology that comes along. I think it's important to understand that everything we've talked about today, including the parts emphasised by Martin around value-based care, is that we're committed to carefully evaluating new ways forward. We truly believe that new ways forward are needed to get major benefits, but we don't accept that just because something's new that it's better. We need the evidence to prove that. And several of these pillars and the projects within it are designed to help us evaluate new technologies to look for the incremental benefit. And then through Program 5 with the value-based care, understand where the win-win here is for this. Better for patients, better for the healthcare system, and better for those who were innovative enough and forward-looking enough to invest in it. So come and talk to us. We're open for business.
Okay, now we've had a couple of questions about, where are children with cancer and young people in this plan, and the VCCC in the strategic research plan had a very successful program of building collaborative links for adolescents with cancer that really do fall between the cracks between the paediatric treatment centres and the adult treatment centres, and have led to some policy changes nationally in the way that clinical trials are looked at for access to those young people. So it has been a priority for that area for the VCCC, and we are pleased in the VCCC to have the Murdoch Children's Research Institute and the Royal Children's Hospital are VCCC members and very active in the VCCC. There are emerging programs in paediatric cancer immunotherapies we heard about in the discovery pillar, and that area has hardly had any impact in the paediatric oncology area to date. So we're delighted to have programs starting there, and we're also particularly delighted, and this is an opportunity to let people know that we are about to commence recruitment of a chair in children's cancer with the Children's Cancer Foundation and My Room charities here in Victoria, together with members of the VCCC Alliance, for a chair in paediatric cancer research, which we're particularly thrilled about. So there is a lot happening, and you can be sure that the way that as an alliance we're structured, that children's cancer is very much on our radar, and indeed has been a strategic priority for our board. So really thank you for raising that important question. I might ask a question. There's a question from Philip Spencer that I might get Martin to address. Activity-based funding and value-based care, how might that fit together? I think that's an excellent question. Martin, thoughts there?
Yeah, that's an excellent question. Thank you for that. It's also a very complicated question. So I think the first thing because it's actually value-based care comes from the US, and there's evidence globally that pay for performance improves outcomes rather than pay for services, as you suggest with activity-based costing. I think what most important is for the program within the VCCC Alliance is this is the value that's actually the value that we're looking at, is how we can best treat patients. So it's the value according to patients. So that's the value component we're looking at. If you take the funding perspective, you really are going to change the whole health system in terms of a move from pay for services, or fee for services, to pay for performance and bundled payments. That's a very, very complicated and massive change and undertaking. So it's definitely not something we can work on and are keen on working on within the program. But we want to improve value for consumers. That's the main purpose of the work in the program.
Thanks, Martin. Now, Sophie, a couple of questions have come up about treating the whole patient and wellness. And, I want to personally thank, Sophie for her leadership within the VCCC Alliance of contributing, particularly to some work that's been occurring in psycho-oncology, which is, we feel is a really, critical part of wellness. But Sophie, comments about treating the whole person and how do we as a VCCC Alliance able to emphasise that?
Yeah, it's a really good question, because it actually focuses back onto the patient, and the patient is a whole person. It's around all of the supports from the initial diagnosis to survival to beyond that. It's all about the quality of life. It's about having the choice. It's about moving through the processes and all the supports that exist, whether it's psycho-oncology or whatever it might be, dependent on what each one of the. And this is where when we talk about groups and how some groups end up having being underserved in terms of access to services, there are also some cultural implications around how particular communities look at the wholeness of the individual around what the supports are required. And sometimes the system has fallen short by not supporting adequately around all of these additional factors. And people will talk about the treatment was excellent, but it fell short when it came to additional supports at the end of the treatment in terms of a range of things that some other people would consider mundane, but really they're critical when somebody's just recovering from cancer. So a lot of the work we're trying to do is to actually take into account all of those different aspects in a way that can be bundled up, so that we are having an emphasis around the whole of the person and their supports around them to make sure that they have access to all of the right services to get them through that journey back to wellness.
Thanks very much, Sophie. Andrew, I might ask you a question that's come up about the money. So we're very grateful for the commitment from the Victorian State Government, as announced by Minister Foley today, for the $27 million. But is it enough money to get all the work done? And are we going to need more support, is the question. Andrew, your thoughts?
Money's always top of mind, isn't it, when you're trying to do ambitious things? Look, this is a pretty prudent investment, and it's incredibly highly leveraged. One of the real strengths of the VCCC Alliance is that it's a partnership between 10 highly successful organisations, each of which have their own cancer research and cancer education and cancer care agendas. And those agendas collectively are between 10 and 100 times the investment in the VCCC. So the way that this can be looked at is, here's a very strategic investment from the Victorian Government through the VCCC Alliance to help add value and really turbocharge some of the things that are already happening, and to lead into new directions where individual partners would not have gone or could not have gone on their own, but in fact the very talented people employed by those partners are ready and raring for action. So it's about lighting some fires to get new things happening. It's about accelerating what's happening already. It's about trying to make us fit for purpose to rapidly bring improvements in the cancer care scene.
Great, thanks very much, Andrew. Well, look, we're going to have to wrap up the Q&A now, and apologies for not getting to all the questions, but we have your questions, and there will be more detailed sessions around the strategic program plan in the weeks and months ahead. So please keep in touch by subscribing to VCCC newsletters and events around the strategic program plan that are going to be held going forward, and that will all be on the VCCC website. So thank you so much to the panel for your excellent contributions today to bring so a bit more depth to some of the concepts that came up in those wonderful animated videos, and particularly for me personally, our panel here of our strategy working group were really critical to bring together this strategic program plan and in getting the support from the Victorian government. So thank you very much for your commitment to the people of Victoria through this strategic program plan. Thank you. Now it's a huge pleasure for me to be able to introduce the VCCC chair, Professor Linda Christensen AO. Linda's chair of the VCCC Alliance, and she's going to share with us a message for everyone who contributed to this plan, everyone who will benefit from it, and for those who have supported it. Look forward to hearing the words from Linda. Thank you.
Good afternoon. I would like to begin by acknowledging the traditional owners of the land where we are gathered and pay my respects to elders past, present, and emerging. I'm speaking to you from the lands of the Wurundjeri people of the Kulin Nation, and I also pay respects to all First Nations people who are here with us today. Thank you to the Honourable Martin Foley, MP, Minister for Health, Ambulance Services and Equality. Thank you to Sophie, Kylie, Martin, Andrew and Grant, and the other 200 people who in the midst of the pandemic have contributed to the development of this important plan. As you may have heard, the process to develop this plan has been inclusive and robust. I'd like to make special mention of the consumers who participated in the process. Your insights have been invaluable and really ensure that the plan is meaningful and relevant. The videos shown earlier today demonstrate the need for improving the cancer care system, the value of shared priorities, and the potential to tackle the challenging and difficult things that we might not otherwise do on our own. For example, increasing the number of people participating in clinical trials really requires coordination. Ensuring more people have access to genomic testing and access to precision medicine requires a collaborative effort. So these challenges are best addressed by true collaborative alliances such as ours. On behalf of the board, I'd like to thank the VCCC Alliance member organisations, thank the Victorian Government, and the Victorian Cancer Agency for your ongoing support and your belief in our mission. Thank you to everyone who has been part of today's celebration. I trust that 3 years from now we'll be able to come together, hopefully in person, to recognise and celebrate the impact of our plan. The VCCC board knows that it is our maturity as an alliance, really that's the secret sauce, that is allowing us to energetically collaborate to deliver such a promising plan. The board is fully engaged and enthused about the SPP. We know that the next few years will be ones of growth and impact for the VCCC. Our plan has a good heart and good bones. The plan is ambitious and inclusive. It includes and harnesses the capability of our clinical and health researchers and their expertise, and the wisdom and experience of our consumers and practitioners. At the center of this work is our shared dedication to improve the care and treatment for people in Victoria living with cancer. I'm extremely grateful to serve such a special organisation, and I thank you for being part of today's momentous celebrations.
Well, thank you very much, Linda, for your leadership and for your inspiration for all of those that work with the VCCC. So the mission of the VCCC Alliance is to harness the capabilities of our members to position Victoria as a trailblazer in research-led, consumer-informed cancer education, prevention, detection, treatment and care. And this plan, I think is an important demonstration of this mission in action. So I would also like to add to Linda's words to thank everyone who's contributed to development of the plan, the board and the members of the VCCC Alliance for their support, the Victorian Government for their investment in our shared vision and the collaborative nature that they take with us. My thanks again to Minister Foley for his endorsement of the plan and for being part of the launch today. I'd particularly like to acknowledge our colleagues in the Victorian Cancer Agency, especially Dr. Dana Schweitek and Catherine Whitfield for their collaboration and support, and the exceptional team of staff at the VCCC Alliance. So I invite now all of you to find out more about accessing the strategic program plan document via a link in the follow-up email or the QR code that we will now show. And while we're getting that up, I'd like to draw your attention to the logo over my shoulder. Some of you will probably recognise that it's changed, because in fact, part of this SPP launch today is to announce actually a formal name change for the Victorian Comprehensive Cancer Centre to the VCCC Alliance. And the addition of that word alliance is really critical, because it's how we go about doing our work with you to overcome cancer together. So I thank you very much for your support and for joining us today, and really look forward to working with you to make a difference for cancer patients throughout Victoria and beyond. Thank you very much.